Archives of Prasar Bharati presents the timeless treasure of golden era.
I think, sir, it would be very interesting to hear from you about the technological advances in the field of neurology and neurosurgery compared to your time, I mean the time in which you started studying till today.
Yes, tremendous advances have taken place. In fact, unbelievable advances. When I started neurosurgery in 1950, the methods of diagnosis were very difficult. We had to make a hole in the skull, put in some oxygen and take pictures to diagnose tumors. And the risk in this procedure was quite high. That is, risk from diagnosis was high. Then anesthesia was poor and many patients died. But gradually advances took place in how to control the pressure inside the skull. You see, the most important thing in a brain tumor is the high pressure that builds up inside the skull, leading to headache, vomiting, blindness and all that.
Was this risk factor related to the brain surgery alone, or was it the same for surgery in other parts of the world?
No, there were, but the brain surgery had much greater risk because of this single factor of increased pressure inside the head. See, in other organs, the pressure can be adjusted. For instance, the stomach, abdomen can enlarge, can become bigger. The head cannot enlarge. The head is a closed cavity. Therefore, any pressure that builds up inside causes severe pressure on vital structures, and that is how the problem arose. But later on, drugs were discovered, how to reduce the pressure. Then anesthesia improved, and we also introduced what's called angiography, that is giving an injection in the neck and taking pictures. So this was the sort of advance almost for about 20 years. In fact, I gave a called the Pandale oration. Pandale was a great surgeon in Madras. The Association of Surgeons have instituted a oration in his memory, and it's a prestigious oration. And there I wanted to predict the future of neurosurgery. This was in 1970-71. I had mentioned a lot of things which could be done, but never could imagine or predict something like the computerized CT scan. That is, the marriage of computer science with radiology enabled pictures of the brain to be taken and shown as if you are looking at slices of the brain. That means the tumor is actually visible without any injection, without any other problem. It is a tremendous, unbelievable advance.
Accuracy is ensured.
Accuracy is ensured, diagnosis is ensured. That one single step forward had made neurosurgery much less risky. The death rate dropped from 15% to almost 1% because tumors began to be diagnosed much earlier by the CT scan, and patients came earlier. There was no problem of increased pressure inside the head. At the same time, we introduced what is called microsurgery, using the microscope during brain operations. So the combination of CT scan, that is early diagnosis, and microscope, that means precise surgery. You see, under a microscope, you see even small blood vessels in the brain. Small nerves can be seen very clearly. So you avoid injuring them. So you just push them aside, don't touch them, don't injure them. And then at the end of the operation, the patient is almost normal. He can sit up, he can walk. Thirdly, one thing I forgot was the tremendous advance in anesthesia. The technique of anesthesia today lowers the pressure inside the head immediately at the start of operation. So the CT scan giving early diagnosis, microscope giving precise surgery, and anesthesia allowing us to operate on the brain without pressure. These three tremendous advances have made brain surgery very much easier now.
You were talking about microsurgery, doctor, but was it a skill you had to learn?
Yes, in a way you had to learn it because under the microscope things are different. The eye and the hand should coordinate.
Did you find it difficult to adapt?
Yeah, it takes a little time, but it was possible because I started it even in 1969, the Microneurosurgery Congress in Vermont. But then, in India at that time, there was no microscope available. And in a government hospital to get a 1 lakh microscope was impossible. You see, I had to suffer from lack of equipment throughout my life, always making do with what you have. That's all we have, manage it. With such difficulty, we were able to compete with world centers and have the risk same mortality as they had. So it was a tremendous task, but I had to thank the anesthetists, the nurses who looked after the patients very well, my assistants who kept awake the whole night. So all these made it possible, but it was an unnecessary, tremendous struggle. It is unnecessary. Why should society not accept and give the facilities? It's very difficult to understand even today. Then of course came the MRI, magnetic resonance imaging. Now today we have got the what's called the magnetoencephalogram. We can use the magnetic forces and detect the changes that occur in the brain, very minute changes. This I will refer to when I talk about research, because it helped in the understanding of yoga, what happens to the brain in yogic states. So to put it briefly, the advances that have taken place were really unimaginable. In 1950s, 60s, 70s, we never thought this would happen, but this has happened. So in future also, maybe advances will take place which we don't dream of now. That will depend on the advances in electronics, in physics. All the allied sciences influence medicine very, very deeply, and therefore one would be foolish to try to predict what will happen. I think whatever will happen will be for the better treatment of the patient. So that is the thing I would like to say about the advances that have taken place.
On a world level, how would you say India rates by way of equipment for neurosurgery?
Today, luckily, because of the advent of private hospitals, it has been possible for those hospitals to import all the equipment that we need, all the latest sophisticated equipment. As far as government hospitals are concerned, state hospitals, they are in a poor shape. But central government hospitals like All India Institute of Medical Sciences, then Bangalore Institute and Chitra Tirunal in Trivandrum, they are really very good. These three central institutes have done well. State governments have neglected medicine in general and specialized surgery in particular. Luckily, at the same time, private hospitals have come. The difficulty with private hospitals is that the very poor cannot have access. That is why I chose to work in the voluntary health services, which is partly private and partly charitable. There, of course, we have got a lot of difficulties to make ends meet, but we have got all the equipment that is needed. The other aspect I would like to discuss is, in general, you see, the purpose of a scientist or an institution is threefold. One is to treating patients. That is very important. You have to be a good doctor, helpful doctor. Then you have got to teach. You have got to transfer your skills to the next generation. So that is the teaching aspect. And lastly, you must add new knowledge. You cannot go on borrowing knowledge from other countries. So these are the three aspects, that is treatment, training and research. I have already told you about advances in treatment. As far as training students, I have trained about 50 neurosurgeons so far, who are all in very good position. Not only inside India, a number of professors are my students, but also in Western countries. Two of the senior neurosurgeons of the United States are my students, and in Australia, Singapore and in South Africa. So that is a good feeling. And apart from neurosurgical teaching, I was very much interested in medical education as such. They elected me as the president of the Association of Surgeons of India. I think after me, I don't think any specialist surgeon has become the president, because a specialist surgeon goes into a narrower field and he is not in touch with general surgeons. but I was elected and I was able to modify a lot of surgical education in this country through various measures. And later on, I was made a fellow of the Academy of Medical Sciences, which is the prestigious body in India for medical scientists. And then I became the president of the academy, of the same academy. We started having examinations in India, which is somewhat equivalent to the FRCS from the UK. And Government of India, they set up a National Board of Examinations, which is really a very good step. This National Board, I was the president for 5 years, examines students in all the specialities in medicine and surgery. There are about 40 specialities, including brain surgery, heart surgery, kidney surgery, liver surgery. And the advantage of this national board is twofold. It is very important to record this. One is it introduced uniform standard of examination. In India, there are about 112 universities, 140 medical colleges. And naturally, in a huge country, the standards cannot be uniform. In addition, the political and social revolution taking place have made it difficult to keep up standards. That's a passing phase. I think in another decade it will settle. But it was so the decision of the Academy of Medical Sciences and the Ministry of Health, the Government of India, to set up this national board was very welcome. Now today we have uniform standard examination, which is recognized all over the country and in other countries also. For instance, if you go for a posting or training in the UK, Australia, Germany, United States, Canada, if you have got the diploma of the national board, then it is an acceptable training qualification. That's one thing. Here I should mention the role of Indira Gandhi. I think I was vice president of the Association of Surgeons, and the Association of Surgeons wanted to have uniform examination for surgery only. We wanted to give a fellowship of the Association of Surgeons, like FRCS. This was in 1970 when she was Prime Minister. So we wanted the Parliament to give a charter for the Association of Surgeons to conduct this examination. So we were a high-powered committee, about 8 of us, the most senior surgeons of India. We sought an interview and she was kind enough to fix an interview for us. She told us, fine, I'll give you a charter, no problem. But then tomorrow the physicians will come. Day after tomorrow the gynecologists will come. So why don't you think of having one body which will conduct all these examinations and then give a uniform degree. That was a really innovative idea. We didn't think of it. We accepted immediately. And within 1 week, she had made Karan Singh, he was the health minister. He called a meeting of a committee, and in 15 days, this board was set up, the National Board of Examinations. It was not called the National Board at that time. It had a different name, but the purpose was the same. Having told about something about my role in medical education in this country, before I finish that, I must acknowledge our gratitude to the Indian Medical Association. In those days, when I started brain surgery, I had to spread the knowledge about brain diseases amongst doctors. How to do that? There was only one forum which was available, and that was the Indian Medical Association. The Indian Medical Association has hundreds of branches, thousands of branches all over the country. And therefore, I could use the Indian Medical Association, write to the local secretaries saying I would like to address your members on brain surgery. And thus, through the IMA, almost for 15 years, I was able to spread the knowledge about brain diseases amongst doctors, because doctors themselves were not diagnosing the diseases. So the IMA was even now is a useful medium for what we call continuing medical education. In all these areas, in the Academy of Medical Sciences, Association of Surgeons of India, in our own Neurological Society, I have been responsible for introducing continuing medical education programs. That has been one of my fulfilling some happiness, because they are continuing programs every year, and the government of India has given us a lot of money for this.
How receptive was this scheme? Have you found a lot of doctors?
Oh yes, because the people are really longing for knowledge. And when you have these refresher courses, all of them are almost fully booked or overbooked in all the specialities. Actually, there is a revival among general practitioners of wanting to improve their knowledge, come up to date. Now we are introducing, the tapes, videos, and CD-ROMs also for the education program. So my role in this medical education has been quite satisfying, apart from neurosurgery. Now the third aspect we must discuss is adding new knowledge. Unfortunately, due to various reasons, historical reasons, 200 to 300 years of British domination, we have not been made to think for ourselves. I think I already mentioned that the British system of education was meant only to create clerks to serve the British Empire. Unfortunately, the same system is continuing. That's why I told you, our leaders do not think of education. I am not saying they are not spending money on education. I don't mean that. What I mean is the system of education as it is not conducive to creating new ideas. How many Nobel Prize winners are in India? We say we have got a lot of MScs and BScs. That's all book knowledge. In Indian thought, intelligence is of two types. One is called Medha, the other is called Pratibha. Medha is memory intelligence. That is, you learn something, you keep it in your brain, use it on the relevant occasion. That is called Medha. Most of us are Medhavis, you can call it, memory-based education. Whereas Pratibha is intuition, intuitive knowledge. In fact, women are supposed to have more intuitive knowledge than men, because in women the right brain is more evolved, whereas in men it is the left brain that is more evolved. So coming back to system of education, our system is memory based. Our children are made to memorize given facts and repeat. In this process, they are not allowed to ask questions or to think. If you cannot ask questions or find answers, how will you add new knowledge? So to say that Government of India is spending crores of rupees on scientific institutes, fine, it's all going into building and administrative expenses, TA, DA and all that. The root cause lies in the schools. The children must be allowed and encouraged to ask questions. Children naturally will ask questions. They are very curious. But our system of education and our busy parents always curb their curiosity. For instance, if a child asks a question and you don't know the answer, you must tell the child, fine, I don't know the answer. Come on, let us sit down. Find out where this knowledge will be available. This sort of a training is available in the United States. That is why they are getting so many Nobel Prizes. Not because USA spends more money. It is wrong. Japan spends much more money. It is the attitude towards new knowledge that will give you results in the form of research experience, research ideas. So no use in saying when you are already MSc, trained in memory education, suddenly to produce new ideas, PhD. So we have got to change the system. Luckily, I was able to induce this sort of an idea amongst all my students. So all of them have taken a research project, and we have published more than about 150 research papers over the past 35 years. And some of these areas are of great interest. One of them is the knowledge about tuberculosis of the brain. We did not know much about this infection. We knew about tuberculosis of the lungs, but that it could affect the brain, it could form tumors we were not aware of. And our researchers have thrown a lot of light on it, how to treat, what sort of operation to be done, what sort of drugs. So in one area we have done a lot of work. I will be very brief about this. The other area is about treatment of head injuries. I already mentioned to you about the role of the forward line treatment in head injuries in soldiers, about my contribution to the thought in the Indian armed forces that they should suture the wound at the site. Like this, we created a head injury unit in the general hospital, the first concentrated unit to treat head injuries, and we evolved new methods of treatment. All these have been published. I'm only briefly referring to them over our talk. The other one, of course, is knowledge about brain tumors, brain operations, new techniques of approaching brain tumors. All this we have done a lot of work. And the other one is what is known as stereotactic surgery. I have already mentioned how it started in Madras. In this technique, we can reach any part of the brain and stimulate, and thus each operation will be a neurophysiological exercise. You learn from each operation which part of the brain responds to. For instance, one part of the brain you stimulate, the blood pressure will go up, the other the pulse will go up, in another the patient will get angry, the other patient will become docile. All these areas we are able to, a lot of work has already been done, but we had also contributed because human experiments, we knew all this from animal experiments, but human experiments are very rare to come by. So when patients are available, we are operating on them, we utilize that opportunity to learn knowledge. So that was a good thing. The other interesting thing, interesting to the public, is about our work on epilepsy. See, there is a widespread idea that epilepsy will occur during new moon, full moon, Amavasya, Paurnami, attacks come. We will say Kritika, it will come. You see, what happens is the patient and the relatives have decided that the attack will occur on Amavasya. So when Amavasya comes, they are all keyed up. The patient is also keyed up, and promptly he throws a fit. So we did some research on this. The brain is an electrochemical organ. It acts through electricity. And now we know magnetism. In those days, 17 years ago, we were only concentrating on electrical disturbances. So the electrical activity of the brain was affected by changes that occur in the solar system. This is a great idea. The paper was published, very well accepted paper. Now, of course, in these 15 years, we know that the changes that occur in the brain occur due to magnetic variations. The sunspot disturbs the ionosphere of the earth and disturbs the magnetism of the earth. This occurs all over the earth, and we are part of the earth. That is the whole great concept of Hindu medicine, Ayurveda, is that the human being is a part of the earth, the Panchabhutas, and part of the universe. Therefore, universal events may affect the individual. Though the individual is so unimportant in a universe, still he is a part of the universe. So these things do affect. And now what is known as magnetoencephalogram is available. That is, just as we record the electrical activity of the brain, we can record magnetic changes in the brain, which are very minute. Electrical disturbance is very gross, whereas magnetic measurements give you very minute changes that occur in the brain. And now we know that when sunspots occur, solar radiation, the magnetosphere around each person's brain is affected. Normally, you and I are grossly involved in gross matters. So unless the disturbance is very severe, we are not affected. Whereas a brain which is liable to epilepsy, already the threshold is low, that can be affected and thrown out of gear. So that was one of the very valuable piece of research, and because a lot of work is still going on now about magnetic energies of the brain and how the magnetic energies influence the brain.
What about the effects that a solar or lunar eclipse can have on the brain, doctor? And what about the pregnant woman? There have been so many myths. Oh, I don't know if it's a fact. They say the unborn child can be affected.
Quite right. As an outcome of this previous piece of research, we had Dr. Sharada Subramaniam, who is very much interested in magnetic energies and biomagnetism. She is doing a lot of research. She was the professor of physiology. She is retired now. And we formed a team, and when the solar eclipse came, I think 10 years ago, there was so much of fear, psychosis caused by Doordarshan, by All India Radio, by the press. The entire city was deserted on the day of solar eclipse, as if nobody lived in Madras city. So we did research during that time. We brought in about 12 patients and we did their EEG before the onset of eclipse, during the eclipse, of course putting them outside, and after the eclipse. We did also the chemical studies of their blood, but we found no change at all. A solar eclipse did not influence the brain activity or the body activity of these individuals.
And what about pregnant women?
Naturally, therefore, this is a myth. In the olden days, the sun, which is the most powerful thing that we know, that human beings knew, suddenly begins to be covered by something, and then it creates a scare. So they want to protect. Protecting the pregnant women naturally, because not only human being, every living being wants to protect its young because it wants to perpetuate itself. Therefore, protection of children and pregnant women always forms a priority in every situation. Therefore, they say it will be affected. As far as we know, there is no evidence that the solar eclipse affects human beings. In fact, Einstein's experiment on relativity in 1919 was conducted during a solar eclipse, because during solar eclipse there are no sunspots. Sunspots are minimal. I told you, when sunspots are maximal, the brain is affected. During solar eclipse time, sunspots are minimal. Therefore, the effect on the brain has to be very, very minimal. There is no scientific proof that solar eclipse in any way influences the physiology of human beings, but the behavior will be affected. Animals will think that the evening has come. We did the experiment in VHS. It was about 4:30 in the evening, I think. Then all the birds began to think evening had come. They began to roost. They began to make the evening noises. They went to the trees. It's a behavior because of the sunlight.
So
that is nothing to do with the physiology of the situation.
So which means it's all mythical.
Yes, it's all mythical. There's no proof at all. It is only does a cloud hides the sun, and does it cause the changes in pregnant mother or
Certainly
anybody?
not.
Instead of the cloud hiding the sun, it is the moon that hides the sun, another body. And umbrella hides the sun. What pregnant women, fetus will be affected, is it? So this is it's a myth that goes on, and there is no harm in having this myth. It's not harmful to the people, so it's okay.
As long as they don't take it to extreme
I already
limits.
told you, in Bhagavad Gita it is said, na buddhi bedam janayet ajnanam karma sanginam. Ajnanam, the ignorant people, if their practices are not harmful, don't disturb them.
Let them
If
be.
it is harmful, it is all right. If it is harmless, why confuse them? Let them have a bath. It's good to have a bath in the sea.
Doctor, we were talking about scientific advances and the giant strides that it has made. What we haven't talked about is brain transplant. Now, what do you think about it, and what are the ethics?
Before I go to that, I think, and just hold it, I'll finish off one more item, then I'll go to that important thing. The other area where we did some work was on yogic states. In yogic states, there is definite proof that the brain action is modified. This work has been done all over the world, especially in India, in Pune, in Delhi, in our own center in Madras, in other yogic 4 or 5 centers in Trivandrum, Cochin, by conducting physiological measurements of the brain activity, of the heart, oxygen consumption, pulse rate, all this in a state of meditation. They are all modified towards the better. In real yogis who are very difficult to get at, there were 3 or 4 of them. One was Ramananda yogi, he was really very good. The experiments were done in Delhi, and we could show that the electrical activity of the brain almost came to a standstill, almost. It cannot stop. If it stops, person will die. The heart was beating only once a minute instead of 60 times. The basal metabolic rate came down almost to 0, and he was buried underneath for almost 6 hours. How did he manage to live? Because at will he could modify the physiology of his body and the physiology of his brain. That is yoga. In states of meditation, you improve the efficiency of the brain. Normally, the brain is controlled not by the higher centers. You see, this office, which we call the brain, is a very erratic office. The bosses have no power. It is the midline clerks and the last line peons, the fourth grade, who run this office. Bosses sometimes wake up and ask something, it is done, then they sleep off. That is, in other words, the brain has not evolved enough for all the higher centers like intelligence, thinking to take hold, but only emotions, hatred, fear, all these are still active. That's why we have all these wars and communal fights and bombs and terrorists, because we are still acting at the lower level, middle level, not the higher level. Whereas in yoga, this is a practice. Just as you do exercise to develop your muscle, yoga in the form of meditation is an exercise to make the bosses of the brain, that is higher levels of the brain, take control of the brain and see that the lower forces, the evil forces of hatred, fear, lust, all these do not take over. This is exactly what happened. This is what our ancients claimed 5,000 years ago. Now we have got electrophysiological proof that the brain activity is modified, and also the chemistry of the brain and the body during meditation state.
Can meditation be prescribed to everyone, including those with nervous diseases?
Meditation should be prescribed.
Because I've heard it said...
Every person should learn to meditate if he wants to have a comfortable life, a happy life, and a useful life. It adds to your equanimity and to your efficiency.
Because I've heard it said that a person suffering from depression, if they meditate, they get worse. Again, is it a myth?
No. Don't go to disease as it. If you talk about the normal beings, we hope we are all normal. I don't think we are all normal, but still we are the borderline of normality. Meditation positively will help. As far as psychiatric diseases are concerned, you have got to suit the meditation to the disease. For that you have got to go to a good teacher. We cannot just offhand sit down and do meditation. What I want to emphasize is that meditating is a form of exercise. It is a healthy exercise and it has no religious connotation. It has nothing to do with the Hindus or Muslims or Jews or Christians, nothing to do with that. It is a simple physiological technique of bettering yourself. When you better yourself, when you are not too angry, when you are not too greedy, then you influence others also. So that way, meditation as an art of improving the brain has full scientific explanation. And during these studies on meditating people, we found that the electrical activity of the brain undergoes a certain change. What is called the alpha waves of the brain increase in number and frequency. So what we did was, why not we try to induce this electrical wave in an ordinary human being who is not meditating. Suppose we induce these waves, will he improve? Will he get better? This was our experiment. So this is called biofeedback. In ordinary biofeedback, the person, the patient has to cooperate. Here there is no such thing. The patient just lies down quietly, closes his eyes. Patient or subject, you may call it subject. What we do is we take the electrical activity of his own brain, separate it into different forms, alpha, beta, theta, delta, these four varieties, and take only the alpha waves and feed it back to the patient in the form of a flickering light. So the light goes on flickering in front of his eyes. He just keeps his eyes closed, relaxed. This flickering light induces the alpha wave in the patient's brain. So as the patient's brain is being recorded, it comes to a state resembling the yogic state. So we asked these patients, they said, we certainly feel much better, much calmer. Of course, you have got to have a lot of controls without wasting much time. Just having a big doctor look at you, light flashing in your eye, number of people coming around, wires being put on your head, all this itself will cause a feeling of importance. So that should not be mistaken as the effect of your experiment. So we had a lot of controls. In other words, instead of feeding alpha waves, we just put random waves. That is to exclude the placebo effect, we call it. Random waves did not affect them. Alpha waves improved the mentality of the patient, whereas the other waves make them excited, irritable. This work has been published all over. The idea, therefore, was used to 3 types of patients. From normal people, we took it to patients. One is patients with epilepsy, intractable epilepsy, frequently occurring epilepsy. The others are psychoneurotics, and the third one was severe headache, uncontrolled headache. In all the 3 groups, this non-volitional feedback helped. This work we did almost for 5-6 years and published a number of papers. In other words, it is possible either by means of a biofeedback technique or by yourself to modify your own brain waves so that you feel better.
When you induce these waves, how long did the effect last?
Yeah, that's a very good question. The first time, second time, third time, it lasted only for about 3-4 minutes after it was stopped. But when you go on doing it, as we did for our patients, then the effect lasted for 3 to 4 hours after that was over. So in some patients in fact, some patients got addicted to it because it's a good feeling, my headache disappears, so let me have it morning and evening. So we gave it. So after about a month of treatment, the change in the waveform persists for some hours. And also the chemical changes. We examined the chemicals in the urine, chemicals in the blood. All these Dr. Sharada Subramaniam helped us. And what's called the chemistry. So those changes are also there. So what the public should really understand is that this technique of yoga has to be practiced every day. You asked me about brain transplant. Organ transplant has become a very common practice nowadays. Kidney transplant, they are transplanting liver, heart. Of course, the difficulty, as you know, with organ transplant is that the body should accept a foreign tissue, what's called immunity. So we suppress the immune response and put in the organ from a suitable person. As far as the brain is concerned, today we have the technique of taking out a brain and fixing it in a skull and stitching the nerves and the blood vessels. The technique is there. With the microsurgical techniques, it is quite possible to do it. But the difficulty with the brain is the nerves, even though they are connected, sutured, will not function, will not send impulses. See, the brain is not a single organ. The brain has got more than 1,000 functions. It is a multi-organ and multi-purpose organ, and it acts by electrical and chemical impulses. You see, the heart, when you attach the heart to the blood vessels, it's only a pump. It can pump, no other purpose, no other work for that. Whereas the brain can function only if the impulses get transmitted. That's why even when you suture, for instance, the spinal cord, leave alone the brain, the spinal cord in the back gets injured in accidents. We have tried suturing it, but it doesn't work. So unless we discover something that will make the nerves function electrically and chemically, transplantation is impossible. Of course, nothing is impossible, but today it is impossible.
But what do you think about the ethics of the whole thing?
Of course, once becomes possible, then there are a lot of very interesting, not only ethical questions, but humorous questions will arise. If you transplant the brain of A into the body of B,
will it be A?
Then it is A only. Though the body looks, the wife B may think he is B, but the wife of A will say that all his qualities are A. So it is the brain that determines our personality. Of course, in course of time, the personality will change. The same thing, if you implant the brain of a woman into that of a man, then what will happen to the man's body? In course of time, will the female brain change the characteristics of the male body? A lot of interesting questions arise, but they are only in speculation now, not in reality.
Doctor, so much has been said about stress and the effect it has on the brain and the human body functions and so on. But don't you think in everyday life, a certain amount of stress is necessary to motivate us?
Stress is very essential for motivation.
Is it harmful provided there is minimum stress?
No, there should be minimum stress. For instance, if you want to develop your muscle, have a healthy body, you have got to apply stresses on the body. Why do people say upavasam, starvation, is good for you? Because you put that stress on the system. So, a minimum amount of stress, an adequate amount, not minimum, adequate amount of stress is necessary for health. The same thing goes with the brain. But the difficulty is the way in which we respond to stress. That should be altered. If we respond in a positive fashion to stress, then you become stronger mentally.
How would you respond in a positive fashion?
A positive fashion means you evaluate a situation for what it is worth and give that much of attention to it as it deserves. You should not bring back old memories, old fears, old hatreds to a new situation and try to solve it. Then you are confusing yourself and confusing the issue. It increases the strain on the system. You get blood pressure, you get ulcer and all that. That's a difficult technique, but it can be learned.
I think
To
it's
evaluate a situation as it is. A person must learn to do that.
I think it's a question of discipline more than anything
Yeah,
else.
and mental discipline and mental practice. And this must be taught to youngsters.
No, that is the problem. We tackle it much later in life when
That's
it's
right.
too late.
We teach them that in a situation for instance, you are playing cricket. The ball is coming. You are concentrating only on that. You are not thinking of what the previous ball did or what tomorrow, what you are going to do. At that moment, you deal with the situation as it has risen within a split second. Same thing. That's how
reflexes.
life should be led.
Doctor, the burning question today is this euthanasia. What are your thoughts about it and do you support it?
Generally, people are against euthanasia because one, they don't understand the problem, and two, rightly, they do not want the power of inflicting death on individuals, because human beings definitely value life, and to say that you can stop life is a thing that has to be looked at very, very carefully.
But would you call it stopping life if you just remove the life supports which are keeping a person artificially alive when he is brain dead? Would you
No,
call
that
that?
is different. In a brain dead person, stopping the life support system, I fully support. Brain death is now well recognized as death, and you have got to stop it.
To
Legally, you are right.
But would you be able to tell whether it is irreversible?
Yes. We have got special tests now and well accepted norms all over the world. They have got to be followed before you say brain death. Now it is a settled question. The question that is important is a person in severe pain, in incurable malignancy, or a person was brilliant, his brain is damaged and he does not know what is happening and is completely degenerated in the brain. Such people, should they be allowed to continue in life or should they die? People who are normal, hale, hearty, healthy will say no, they should not die. But how about asking the person who is suffering that question? Many people who are suffering would want an end to their suffering. So this question is not often asked. What is the patient's point of view? In Holland, there is a law now that allows a patient to want to die and the doctors can help them to die. There are certain provisions. 2-3 doctors must be involved, an advocate must be there, a lawyer, and the patients and near relative should be fully aware and give it in writing. Then, for instance, you can stop life support system or go on increasing morphine so that gradually the patient will sleep and die. There are many ways of doing this, but the ethical question always remains. As far as India is concerned, it is very clearly said, Na Vaidya Prabhur Ayushaha. Vaidya, the doctor, is not the Lord of life. The duty of the doctor is to diagnose disease, Vyadehe Tattva Parigyanam, and Vedanayascha Nigrahaha, stopping pain, relieving suffering. These two only are your duty. You are not the Lord of life. It is very clearly mentioned in our ethics, and the doctor should not assume lordship over life. But I do get situations where the patient begs for death, begs for mercy because of impossible pain. So there you have got to consult so many people and come to a decision But still it is a very difficult.
It is difficult.
Very difficult.
It has been such a fascinating experience for all of us at All India Radio listening to you, and we've taken a voyage through your life, as
Thank
it
you,
were.
thank you.
And you've lifted the curtain on so many little facets that the public doesn't know, and you're a person of a great achievement and contribution.
Thank you.
And I do feel tempted to peep a little more into your daily life. For instance, you haven't told us about your grandchildren. How do you interact with them? And do you get time to play with them at all?
I try to make time because I never had time to know how my children grew up. It was all complete sacrifice for neurosurgery. I don't remember how my children grew up, and my wife looked after them, I suppose. But my grandchildren, I make time because I am very fond of children. They also react, even my children patients who come, I play with them, and they are fond of me, I am fond of them. Luckily, it's an attitude of mind.
How many grandchildren do you
I
have?
got 5. One of them is already a medical student. The others are in school. In fact, when they visit us, we spend a lot of time together playing pranks and jumping up. You have got to interact with children because they are the ones that keep your mind and ideas young. That's why interacting with the young students is a very refreshing thing.
I think that's how you've kept yourself young,
I hope
Doctor.
so.
How do you see yourself, say 5 to 10 years from now? Will you be still working at the same pace, or will you cut down on your activities? Will you sit back?
I don't know. The future is very difficult to see, but given the present state of health, present state of motivation, I think I'll be working because I feel happy only when I am doing some work. Somehow I am not able to sit and just do nothing, what is called Shuma Chamyar. See, there is a story of Shuma Chamyar. In the temples, they give this cooked rice to some people. And in the account, it was written 2 bowls of cooked rice to Shuma Chamyar. So this religious endowment chap who visited the temple, he wanted to know who is this Shuma Chamyar. He said, he is there. And what is he doing? He is just sitting. He said, what? You are giving cooked rice for a fellow who is just sitting? No, it should not be done. But this trustee is a very experienced person. He said, what you say is very correct, I agree. Let us think of it. We'll finish our temple rounds and come back. Then they came back and sat. Then the trustee said, why not we keep quiet for 2 minutes? Let us pray and be quiet for 2 minutes. This fellow who is objecting to Shuma Chamyar could not stay quiet even for half a minute. He began to fret, he began to move, he began to talk. So after 3-4 minutes, this trustee told him, now you see how difficult it is to be Shuma. To be a Shuma Chamyar is one of the assets of this temple, so don't disturb it. So I somehow cannot afford to be Shuma. I have found it. Even my children blame me for that. But I suppose so. If my health and the motivation keeps going, I think I will be doing something or other, I think. I would like to.
No, I'm sure being young at heart, your health will be good, and
Thank
I'm
you.
sure you'll contribute a lot to society as you always have done.
Thank you.
But what about all the things you have dreamed of doing and never had time for? Would you be pursuing those sort of interests?
No, even now, I have got a lot of spare time for studying science, for studying philosophy. I read some amount of Sanskrit. And occasionally, nowadays, I go to some concerts or upanyasam or something, but once in a month. I don't have time for more than that, though I would like to do that. But then, this question my wife and I discussed. When we are 60, I said, we have done enough for society, we have enough to live on, why go on working? Then we decided that we have got certain skills which are useful to the public, and why not we make it available to them? And anyway, if we don't do anything, what are you going to do? Play bridge, play golf or gossip? It will be a waste of talent. I mean, if God has not given you the skill, it's all right. But when you have got a particular skill and you can still use it, it is worthwhile. That's why even Mrs. Ramamurthy is still very actively, it is almost the same age as myself, still delivers babies, operates, works 12 to 13 hours a day.
And the leading gynecologist.
Yeah,
Most people talk
so
about
it's a conscious decision that we have made. I mean, I'm not claiming any credit for it, but that's how it was.
Thank you so much, Doctor.
Thank you.